Hi, I'm Tim Iliff, a licensed acupuncturist with a doctorate of acupuncture in Chinese medicine. This is a presentation I did at a mental health conference about how to use the five elemental systems to help work with different types of depression. The view of health and disease in Oriental medicine is that when things are balanced and move well, there is health, and that when things are imbalanced and or do not move well, then disease is able to occur. Basically, you look at the body as a set of flowing rivers, and when the rivers flow, the water stays clean and clear. When they get blocked or the water gets stagnant, things start to go a bit awry. The Chinese saying is tong zibutong, tong zibutong. Where there is free flow, there is not pain. Where there is not flow, there is pain. The goal of Oriental medicine and acupuncture is to bring a person back into health through rebalancing them and allowing flow throughout their entire system. The view of the body within Oriental medicine is that the organs, they're not single organs, they're grouped into functional systems that may or not be the same as some of the Western parallels. For example, the kidney system within Chinese medicine not only covers the functions of water metabolism, but also covers functions that would be associated with the adrenal glands and some aspects of hearing and bone health. Five of the branches of Oriental medicine are herbs, including specific herbal formulas, food therapy, which is how you alter your diet to deal with specific health conditions or even prevent disease. Tuina, which is Chinese medical massage, and can be used to address both external musculoskeletal conditions as well as internal conditions. Qigong, which is exercises that you do for your health that work in ways that are similar to acupuncture and Oriental medicine, and also activities that can be done on other people to actually help them as well through it. And then, of course, acupuncture, which is the use of sterile filiform needles to stimulate reflexes to help bring about health and recovery. Herbs are used both internally as medicines and taken for a variety of complaints, and externally for topical disorders such as rashes, bruises, or even just swelling. In Chinese medicine, herbs are almost never used on their own or singly, and are almost always used in combinations of four or greater. The herbs can also help to balance each other, either reinforce the effects of something or help to minimize any possible side effects. Ginseng, which is a well-known herb, can be used for digestive symptoms when paired with licorice and poria, whereas if it is paired with mume fruit and opigonen tuber, it can be used to treat spontaneous sweating and help to stop that sweating. Food therapy is another branch of herbalism because you use the same set of looking at the nature and the temperature of foods and herbs, and you can base it on their category. Things that can be hot or cold, moving or gathering, dispersing or binding, and they can taste sweet, sour, bitter, pungent, salty, or bland. And they have actions like what the food does in your body. Does it moisten? Does it raise things? Does it make things go down? Does it drain things? Does it dry things? And that's all what you look at for your food as well as your medicines. In food therapy, there are some simple dietary changes that can actually help to alleviate and minimize some pain. One is you want to avoid anything that's cold, sour, or raw. Cold foods like ice water, they can make the body colder, and cold tightens the body like when you go outside with no coat, and that can actually worsen pain. Sour foods you want to avoid. The sour flavor does what's called astringing and pulls things in and tightens, and it particularly is effective on the muscles and ligaments. So if something's overly loose, sour food can help with that, but if it's over tight, it's like cranking that wrench two more turns. Raw foods are hard to digest and difficult on the digestion and requires more blood and more energy because we only have one stomach. So that can exacerbate muscle cramps, particularly if you already have a weak digestion. Tuina. Tuina is Chinese medical massage. It uses a variety of manual and energetic techniques to address complaints, from musculoskeletal disorders, something as simple as a stiff neck, to knee pain, to internal complaints such as digestion or even respiratory disorders. One of my teachers talked about somebody who had just taken a seminar, opened a book to an asthma protocol, did it on someone's back, and actually helped to relieve their attack. Qigong is a type of therapeutic exercise that is based on the theories of Chinese medicine. There are over 10,000 forms of Qigong, and there are exercises for everything from the muscular system to digestion to immune to stress. So it's a nice form of exercise that can be very gentle on the body if you choose the right form. Acupuncture's usage of tools, including needles, to stimulate points in the body to help facilitate health and well-being. There are a variety of methodologies that you do tend to use with acupuncture some of the time, including cupping, that's where you see the big octopus marks on people, gua sha, which is a form of scraping massage that'll look kind of like a bruise, but will tend to help improve the circulation to an area on a longer terms. And then moxa, which is the burning of herbs near the skin to help warm areas that are very cold. There are a lot of different types of acupuncture, which have slightly different ways that they work with patients and their bodies. TCM is the current codified system practiced in China. This was developed really in the 1960s. There are Korean, Japanese, and other systems that kind of sprung off of Tong-style Chinese medicine. There are microsystems where you treat the entire body on one part. For example, auricular, where you treat the whole body in the ears. The earlobe is viewed as the head, and the top is viewed as the feet. And then on the hand, where the whole body can be treated on the hand. And it's a nice thing to do if actually just something's kind of aching, you can massage there and help yourself. Now we're going to go over the penny, nickel, and dime tour of acupuncture. The penny tour, acupuncture works by stimulating points that have a reflex that helps to relieve pain or address a condition in the body. Slightly more in depth, the nickel tour. The reflexes triggered by the points are organized by channels which run through the body, which let you know where you can get to, like why when someone has a headache, you will put a needle in their hand, or why if their digestion is bothering them, you'll put a needle in their leg. And the dime tour, the channels are organized based on the organ systems of the body, and many of the functions are based on the associated organ systems. Like if you're treating the stomach channel, you'll treat a lot of digestive stuff, but also things on the course of the channel, like the eyes or the sinuses on the front of the face. The diagnostic process of acupuncture, you start with an interview. You look at the patient, you listen to them, sound of their voice, you notice if there's any distinct smells, you ask them questions, and last, you actually touch their body, check their pulse, palpate their abdomen, check the channels. So you go from the least invasive to more invasive as you go throughout the process. Looking, you observe a patient's basic condition, how they walk, how they look, color of their face, how their posture is, what their body language is, their overall mien. Then you can look at facial diagnosis where you have specific areas that corresponded to specific organs and conditions. And then the tongue, where different parts correspond to different things. And even the condition of the tongue body itself will let you know on particularly how their digestion is doing. Smelling and listening. Does the patient have a distinct smell? Does their body smell? Does their breath have a particular smell that you notice? A common example of this is the sweet smell on a diabetic or the sour smell of somebody who's highly stressed. Funny enough, sour actually is the smell of wood or the liver, which has to do a lot with frustration. And then listening, you listen to the tone of their voice, how they answer, how they talk, how easily they breathe. Asking, and then you ask them questions. There are 10 categories of questions that are asked for systemic review, and then you ask further on any of those findings. Here's an example of the 10 basic questions. Chief complaints, symptoms, their vitals, ears, eyes, nose, throat, pain, how their sleep is, bowels, urination, their body temperature, their sweat, if they exercise, how their digestion's doing. For women, how their menstrual health is, which is a major part of health. And then you go into touching, which is palpatory diagnosis. You check their pulse. There are 3 positions on each side that have different organs and systems that they're associated with or parts of the body. And there are 6 separate depths on each position, which tell you a little bit more about what's going on. Then there's a full diagnostic system on the abdomen where you can actually feel what's going on with different of the internal organs by palpating their abdomen. You can also even palpate the ears and feel different reactions and different textures based on where things are either a little unhappy or injured. And then channels and area palpation. You can tell sometimes palpating the channels how the organs themselves are doing. Because when an organ is fairly healthy and there's a bit of an injury or an illness, it'll tend to affect the channel to try and keep the pathogen or injury from affecting the organ itself. Emotions and health within Chinese medicine. Emotional imbalances within Chinese medicine are viewed as both causes and symptoms of disease. The elements and the emotions. Worry is associated with earth. It can present with digestive problems with physical, mental, and emotional. Like if you've had something that happened that just got stuck that you can't really digest and, make a smooth part of yourself, that would be a earth issue. Anger is associated with wood, and it can present with joint and digestive problems, but different than the earth ones. It's more that things get stuck and don't move regularly, and eye issues. Grief is associated with metal, which is the lungs, and it can present with respiratory issues and just a lack of energy. Fear can be associated with water, which is associated with urinary and bone issues. Just like when somebody gets really scared, they can actually have urinary accidents. And anxiety is associated with fire, which can lead to circulatory issues. Like if somebody gets real anxious, their hands and feet will tend to get a bit cold. Emotions in the body in Chinese medicine. Emotions have a tendency, according to Chinese medical theory, to store in one of two places. And their associated organs, anger in the liver, anxiety in the heart, or in the musculoskeletal tissue. One of the reasons why this really matters is there's a potential emotional component of physical disorders and a potential physical component of emotional disorders. Not exactly a somatization of the said disorders, but just as somebody's anxious, you'll notice their neck gets tighter and tighter and tighter. If somebody has a really severe internal illness like cirrhosis, they'll tend to have a bit of a shorter temper. And you can also differentiate a single diagnosis like depression based on the elemental criteria. So a metal type depression, the person will tend to be more listless, more grief. Their face will be pale, difficulty speaking, kind of hear the obsessive thinking. When they're obsessively thinking, their mind tends to wander down a bunch of different paths. It doesn't circle back on the same thing. Water, they're more fearful, really tired, nervous, just kind of exhausted and weighed down. Wood, they're angry. They're just so pissed and frustrated, they've just kind of given up. If they exercise, they feel better, but it's really hard for them to exercise. Best exercise for this, honestly, is walking or getting out among plants because the green is very soothing. Medication for this would be forget it all. Fire. This is more of an anxiety depression mix, where they're anxious, they'll feel weak, and they're just kind of so on edge that they wear out. Earth type depression, they're overloaded. They just can't take it all in. It's all too much. They're fatigued, lack of appetite, might have some bloating. They obsessively think about the same thing over and over again and have a hard time getting off of it. Case study on depression. A 73-year-old Hispanic male with current diagnosis and history of rectal cancer with a primary complaint of nausea. He had low energy, depressive oppression thinking, and his was a metal type of depression. I assigned him to play the harmonica. He was terrible at it, but it helped him out, so he would actually only play in his truck when no one could hear him. But within a couple weeks, he had more energy, greater clarity of thought, and his mood was a lot better and brighter. Even his family commented on it. Second case study is a different one. This is the wood type of depression. Cece, a 27-year-old female with a chief complaint of acne that flared up after the ending of a 13-year romantic relationship. She reported feeling frustrated, stuck in low energy, but that improved anytime she exercised. Her suggestion was to take up kickboxing. 3 weeks later, the acne was gone and she's in a much better mood. Your results may vary. And there are other types of pathologies for depression. There's the mixed type, wood and fire. They're frustrated so long or so badly that they become highly anxious. But this isn't the big anxiety where they're going to go do something, they're just overwhelmed. And phlegm fire, mania and withdrawal. And this is the kind of person that they're real anxious, real up when the mania is going on. And when the phlegm is going on, it's more like there's just nobody home. How you can actually use this is differentiating the different types of depression aids in selecting of possibly more appropriate adjunctive therapies to help people. Metal types can sing, wood types can do some physical exercise. Water types, because of their nature, will really like meditation or anything that helps them feel like they're flowing. And there are 5 basic constitutions in Chinese medicine: metal, wood, earth, fire, and water types. The metal types have square features, pale skin, tend to have more body hair, They'll have a tendency towards respiratory issues, particularly early in life. And metal types tend to think of things as right and wrong, and that's tends to be how they interact with the world. Wood types, they tend to be sinewy. Their skin will be dark with almost kind of a greenish cast to their complexion. They'll tend towards liver gallbladder issues. And these are the people who really like to get things done. If they care about you, they're going to help you get your stuff done, but they really have issues with frustration. Feeling like they're unable to get something done will tend to give them more issues. Earth types, they tend to be fleshy, not necessarily fat, just a healthy fleshiness. They can have a yellowish cast complexion if they're not doing well. They tend to love to eat or live to eat. And for them, they will get overwhelmed by too much. Just, it'll be too much. But this is also tends to be a lot of caretakers if they're healthy. These are the ones who walk over, have you eaten yet? And, tend to just take care and nurture everybody. Fire types, they can either have thin hair, curly hair, red hair. They'll tend towards circulatory issues, and these are people bright flashes of inspiration. They'll bounce from place to place. Balanced fire type is a ton of fun. Imbalanced fire type is exhausting. Water types, they tend to have a long torso, have a little more darkish skin, and will tend towards urinary and kidney issues. Water types have this natural appreciation for philosophy and flow. And as long as they're flowing and living in harmony with the philosophy that they have chosen, they tend to do better. Further refinement. All types divide into at least yin and yang pairs, i.e. yin-wood, yang-wood types, or liver and gallbladder. Fire types further divide into 4 separate types. The small intestine type, this is a performer, this is the singer. They're very self-focused. Their sentence can start with I and end with me if they're imbalanced. The heart type. People like the Dalai Lama, they can meet anybody on their own level and work with them right there. Usages. Likely ways that an individual will present based on their nature. Gives you some just kind of hints about yourself or people you're interacting with. It's also additional ways to tell how long or severe a condition is. Someone is presenting within their constitution. It's more of a recent condition, can be less severe, they're overall healthy. But if someone with a water condition is presenting with a earth type problem or wood type problem, they tend to have had that problem longer, or it's a more severe problem that's starting to kind of spread. So these are just some ways that you can look at how to work with yourself, how to look at the elements, and just can give a little more insight in how you interact with the world. Thanks for your time. This is Tim Iliffe, LAC with the Acupuncture Center. Have a great day.